When you're in high school, fitting in with a crowd is very important. Usually, this means dressing like they do and doing what they do. But for Natalie, not her real name, fitting in meant abusing prescription drugs. Her first experience was in high school when a friend's boyfriend gave her Ritalin. It's a stimulant for those with ADHD and narcolepsy. Later, when Natalie was in college, stimulants were an easy way to balance out the pressures of school and work.
Yeah, I mean, it is something that really can help you jumpstart your day and not be dragging because, I mean, this stuff's pretty powerful. It really wakes you up and you're just go, go, go all day.
In the past, Natalie sold and traded prescription drugs with friends. According to her, this was common when people ran out, and it's pretty inexpensive. Steve Steiny with Mecca Services in Central Iowa says teens and youth don't look at the issue too seriously because they lack accountability. Steiny says there's a few issues driving this trend. He says predictability and easy access to prescription drugs make it normal for young people to use them, and it happens more often with the stimulant classes.
I'm seeing more often than not youth will report abusing a drug in the stimulant class, like an Adderall or a Vyvanse or something that is in a stimulant class, but still a prescription medication.
As prescription drug abuse continues to grow in Iowa, law enforcement officials are trying to deal with the problem. The assistant director of Iowa's drug demand programs, Becky Swift, says most people don't consider the danger because they don't consider the risk. Swift says that's because these substances are coming from medical professionals and not off the street.
So really the availability and awareness, access, and then that attitude, that lowered perception of risk are several of the things that really play into the reason why we're seeing much more abuse of medications. It's also relatively inexpensive.
According to Swift, most people forget that narcotic painkillers are opiate-based. She says drugs like Oxycontin, Vicodin, and Darvan are pharmaceutical heroin. But as prescription drug abuse continues to rise, the most vulnerable to it are those between the ages of 12 and 20.
One of the areas where we're seeing the biggest rise is among youth who are junior high and high school age, so about 12 to 17. We also know that we're seeing more use, particularly of stimulants, among college-age students, particularly Adderall.
Iowa is trying to stop the problem where it starts, with medical professionals. The state began a program in 2009 which tracks controlled substances dispensed by doctors and pharmacists. The Prescription Drug Monitoring Program, or PMP, is an online database run by the Iowa Board of Pharmacy. The executive officer, Terry Wachowski, says the program allows providers and pharmacists to review patient drug schedules with a keystroke.
The report immediately goes back to the requester. They can review that report. They can see what other drug schedules have been prescribed for that patient, by whom, over what period of time, and it's designed as a tool for those practitioners to help them make safe and effective treatment of their patient.
Wachowski says the program is voluntary and has about 1,800 prescribers and 900 pharmacists signed on. The governor's office will release a new report on drug trends this November. By then, state agencies and departments will see if working together and sharing information has helped. In Des Moines, I'm Roland Maldonado, Iowa Public Radio News.